Okay, guys, so we're going to look at body planes in this lecture here today. So what you're seeing here are the three basic body planes. They divide the body into different quadrants. We would use these. You can see the images down here. These are MRI images. A lot of times we talk about a mid-sagittal MRI or a frontal MRI. It just depends on what you're wanting to see and how you're wanting to kind of slice the body up into different sections. Specifically in dissection, when we do these kind of dissections, we want to divide the body into one versus the other. So on Thursday, next week, you're going to get it, or Thursday, you're going to get a chance to kind of look at that, hopefully with your dissection. So the first one here is what's called mid-sagittal or median. So mid-sagittal median divides the body into right and left. You can see this plane runs directly up and down from the skull all the way through the feet. All right. In this case, they divided the person directly in half. All right. You can see that in the MRI here. We've made a slice directly down through the top portion of the skull, down through the cervical vertebra here. And you can see both sides, or one side of the brain. You could scroll that out then on the MRI and see the other side of the brain. All right. The way that I tend to remember this is mid-sagittal. It can also be just shortened to sagittal. So there is a suture that actually runs right down the middle of the skull up here that divides our two what are called parietal bones. They're the bones that sit just above our ears on both sides of our skull. So that sagittal suture divides the skull kind of in half. All right and left halves. So that kind of helps me. Hopefully that'll help you. The next one over here is the frontal plane. So the frontal plane divides the body into anterior versus posterior, or front and back. All right. Same thing here. You can see the MRI image. So now we've got a slice down through here. You can see the entire heart, or at least the back side of it. All right. If we scrolled back out, you can see the rest of that. You can see the lungs. The lungs show up kind of on the MRI as a dark space. Same thing with the inside of the heart because it's a hollow. They're both hollow organs. You can also see the liver down here. It shows up a little more dark. It's more dense tissue. Okay. There's another suture that runs through here, which is the reason why they say coronal in this section. So coronal suture is the suture that runs from one ear over to the other ear and eventually essentially divides this bone here on our forehead called our frontal bone from the rest of the skull. So again, it's dividing the skull into front and back, or anterior versus posterior portions of the skull. This kind of a cut right here, if you did that, we have several paired organs in the body: heart, lungs, sorry, not heart, lungs and kidneys. All right. So if you were to do a frontal plane, you could actually see both pairs of kidneys in that and both pairs of lungs, depending on where that slice was at. The last of those two planes that we have then is the transverse plane. The transverse plane divides the body into superior versus inferior, or top and bottom. All right. You can see the slice here. This is another MRI image. We're looking in the abdomen. You can see that by the picture down here at the bottom. So you've got liver over here on the right-hand side of the patient. You've got spleen. You've got stomach, spinal cord back here. All right. And then this is the large aorta and inferior vena cava coming back up to the heart. Right, that you can actually see in there, but that's transverse, so it's top and bottom here. You could also see both pairs of, or you could see both organs in a paired organ set. So the kidneys, if this slice was about right here, the kidneys sit kind of here against the back wall of the abdomen, so you can't really, so you can't really see them here. Right, they don't show up as well. But if you were to make this slice, you could see the top and bottom of both of those organs. If you move that slice up into the lungs, again, you could see top and bottom of the lungs as well. So those are a couple of those. This is just showing those dissection planes in relation to the cat. They change a little bit, again, the same way with our orientation of superior versus inferior and dorsal versus ventral, because, again, the cat's four-legged. So if we start here with the frontal plane, all right, sorry, I'll go with the directions here. So we got mid-sagittal, so that's the sagittal plane they're showing here. So the sagittal plane for the cat actually divides the cat into right and left. All right. The frontal plane for the cat then divides the cat into top and bottom, or in this case, dorsal versus ventral. And then the transverse plane actually divides the cat into the front and back. All right. Or in their case, caudal and cephalad. All right. Caudal meaning tail, cephalad meaning head. All right, so it changes a little bit in the cat, but again, the same kind of slices here. Here's just the definition of those at the bottom. All right, so make sure you're taking a look at those: mid-sagittal, frontal, and then transverse. All right, those are going to show up on your quiz on Friday, so make sure you know the differences between those. Okay. So this one just kind of talks about what I was referring to in the one slide about if you were to make a cut along an animal, or cut an animal along two planes so that the paired lungs are observable in both sections, what two sections would you cut that cat along? All right, again, it would be frontal plane because you would see the top and bottom of the lung, or it could be the transverse plane because you could see the front or back portion of the lung in this case, or the cephalad or the caudal portions of those lungs. Okay. Real quickly, just want to go over a couple abdominal pelvic quadrants. These are really important, specifically when we get into the digestive system, because you want to know what you're looking at when you're looking at the patient. So in this case, you got to remember, when you're looking at a person or a patient, you're looking at their side. So everything gets referred to off of their side. So sometimes it gets a little tricky. And I will be honest, in the athletic training room, sometimes I have to kind of turn myself and remember which side I was looking at as when I put in a note on an athlete if they've become injured. So it happens. Just kind of know that when you're looking at it, you're looking at their right and their left over here. Okay. So in the top right quadrant, we'll start here, there are a couple pairs of organs that you want to kind of make sure that you note. So the main organ in the top right quadrant is your liver. All right, that's an important thing to kind of note. If you got a patient that comes in with top right abdominal pain, you wonder if they've done something to their liver here, especially like a football player or even a soccer player or a baseball or softball player. If they were to take a blow to this area of their abdomen, there's a good chance that something could happen right there. So we want to kind of palpate, make sure that we don't have anything going on. If you're listening with a stethoscope, you should be able to hear the upper portion of the large intestine. All right, so small intestine dumps into the large intestine here and then runs up into the large intestine. So you really should only be able to kind of feel that there. Lower right quadrant, the only thing that's important here, I guess, and essentially is the ascending portion of the large intestine. So that's the part that's going up. And then this little thing right here is your appendix. All right. So that's the only thing that's in that portion of our lower right quadrant. So again, if you have a patient that comes in with lower right quadrant pain, you wonder if they've done something to their appendix. So you start to kind of palpate. Over on the left-hand side, we've got a couple other organs. So upper left, big things in the upper left, you've got your stomach right here. Okay. And then this back in here is, you can kind of barely see it, but this little thing right here is not part of the stomach. It's actually a little organ called your spleen. All right, your spleen actually helps filter blood for you. If you've got a patient that comes in and starts complaining of upper left quadrant pain, all right, and they don't have a history of having like a large meal or something similar to that right before they came in, you wonder if they've got something going on with their liver. So that could be a sign of mononucleosis, because the spleen would become enlarged. I have had some athletes take a blow to that side of their body and cause a rupture of their spleen. All right. Both the spleen as well as the liver, if you've got any kind of pain around either one of those, it's an emergent situation. Okay. They're both hot, they're both solid organs. They can actually fracture. All right, so they can tear apart instead of kind of compress like your stomach could compress or your lungs could compress, and then they'll bleed out. All right, so if you suspect any problems at all, you want to refer those individuals to the emergency room as quickly as you can. But I think in my 15 to 20 years of athletic training, I've seen one of each. I've seen one liver laceration and one spleen laceration, thank God. Okay. All right. The last portion here is the lower quadrant. Again, lower quadrant, we've got descending colon or the descending portion of the large intestine, and then just some small intestine over here in this issue. So really the major ones are your upper quadrants, because there's some really important organs in there, and then obviously the appendix down here in your lower right quadrant. Okay. All right, this just shows some of the major organs of the abdominal pelvic region itself. All right, this just shows them without the quadrant laid over the top of them. So again, the thing you have to remember is this quadrant really only sits here and then divides us pretty much right along here. Okay, so All of this upper quadrant here is thoracic. So that's lungs, heart, lung on the other side. Diaphragm runs pretty much right across through here. All right, they've taken it out of this picture so we can't see it. All right, and then here's our organs in the lower portion. Okay, just kind of labeled for you. All right, we're going to go ahead and finish up there. I will try to get some other things posted for you guys for next week, but don't forget we got quiz coming up on Friday over most of the directional terms. There won't be any of these quadrant things on that quiz, so don't get too shook up about those in preparation for that. Okay.